Recently, a 28-year-old man died of heart attack while having sex. Ajay Pataki from Nagpur was having sex with his girlfriend in a lodge where he succumbed to heart attack and died of it. The question is sex the cause of his heart attack? Is sex the cause of his death? After making the video of the benefits of having sex regularly for the men and also for the women, I got a lot of comments in regards to that, and people were like, sex is the cause of heart attack. Then I decided to surf the internet and get some updates about sex and people dying from it as a result of heart attack. And I decided to throw more light on this today. Welcome back to Nurses Lecture Room YouTube channel with Nurse Miss Mary. Let's talk about what? Let's talk about your reproductive health. It was reported that Pataki was a driver by profession and also working as a welding technician. It was also reported that Pataki had fever a few days before the incident happened. Now the question is, do you think as an individual that sex was really the cause of heart attack for Pataki? For me, I feel sex is not the cause of the heart attack for Pataki. There could be that Pataki had an underlying disease condition that he was battling with. And one of the example of some underlying disease condition that he could be battling with is coronary artery disease. Because an untreated coronary artery disease will cause fatal incident during sexual intercourse. You may want to ask, what is coronary artery disease? Coronary artery disease in the layman's language is simply when the blood vessel supplying the heart is being blocked. And we know that when the blood vessel supplying the heart is being blocked, there's going to be a fatal incident. The heart will not be getting enough oxygen, will not be getting enough blood supply. So there could be a possibility that Pataki had an untreated coronary artery disease, or there could be other risk factors I'm going to be sharing with you. It could be Pataki fall under this risk factor. That is why he had an heart attack during sex that led to the death. So one of the risk factors is smoking. Yes, we all know that generally smoking is not good for our heart and is not also good for our lung. It's not good for our heart in the sense that smoking can build up plaques in the blood vessels. The question we should ask ourselves is, was Pataki smoking? Because if he was smoking, that could put him at risk of going down with a coronary artery disease and also heart attack that could lead to his death. Then another question, another risk factor is have high fat diet. High fat diet also build plaques in the blood vessels. Diabetes also puts you at risk of going down with CAD. High cholesterol food, like taking food rich in high cholesterol, can put an individual at risk of going down with coronary artery disease. The other one I want to share with you is high blood pressure. Could it be that Pataki was treating high blood pressure? He had an increased blood pressure, he didn't take his medication or something like that? Could it be that Pataki was overweight, he was obese? Because being overweight and obese puts you at risk of going down with some heart disease, because being obese and overweight puts a lot of strain in the heart. Then another one, poor diet choices. Could it be possible that Pataki was having poor diet choices, was having high alcohol intake, or was not physically active, though he was a professional driver and also working as a welding technician? In all, what I just shared with you are the risk factors of coronary artery disease that are likely going to result in an heart attack during sexual intercourse. So if you're an individual, you're smoking, I would advise you limit smoking or quit smoking. If you are taking excessive alcohol, you are not active, these are the things you should work on. And also, if you are taking high fat diet, high cholesterol diet, and less of vegetables, these are the things you should also consider, because that may result in heart attack that might lead to the death of that individual. And if you are having high blood pressure, it's advisable you take your antihypertensive, your medications that are going to help you reduce the blood pressure. But before I go, I would like to share with you the signs of heart attack that you should take note of and be observant about, so we don't end up having heart attack that will lead to our death during sexual intercourse. So the first one I have to share with you is chest pain. If you are having chest pain, you are having discomfort in your chest, any discomfort in your chest region that is not going away, I would advise you speak with your doctor and get the proper investigation done. Then another one is pain around the jaws, around the neck, around the arms. So if you are recurrently having pains around this region, I would advise you speak with your doctor. And another one is shortness of breath. If you know, like, oh, any small thing I'm tired, any small thing I'm having difficulty breathing. See, shortness of breath is not something you should joke with. Shortness of breath is not something you should underestimate when it comes to your heart health. So if you're having shortness of breath, I would advise you speak with your doctor. If you're having nausea, frequent nausea, you're having cold sweat, please speak with your doctor, because these are signs of heart attack that might be detrimental to your health. So this is what I have to share with you. In conclusion, sex, I feel from my own perspective, is not the cause of heart attack. There might be underlying disease condition that predisposes this one to heart attack. Like sex, like any other exercise, when you are not feeling too strong, you're having issues with your heart, with your lungs, and you are involving yourself in exercise, that might be dangerous to your health. You get, for example, an asthmatic patient that is not taking his medication, engaging in race, engaging in a long-term race, engaging in a long jump, engaging in a high jump, that can be detrimental to that individual's health. Same thing applies. So if you're having an underlying disease condition that has not been treated, that might be the reason you're having that heart attack. So speak with the doctor, get proper medication, get proper treatment, and prevent unforeseen circumstances. So thank you very much for staying tuned. Thank you very much for watching this video. Please don't forget to like, don't forget to subscribe, don't forget to drop a comment, and also don't forget to share with a friend if you got value from this video. And may the soul of Patakil Ajay rest in perfect peace. Amen. And I pray the good Lord give his family the ability to, you understand? I don't even know what to say. I just pray the good Lord give them the ability to be able to live with the loss, because it's not really easy losing someone close to you and someone you really cherish and love. All right, bye, and see you in our next video.